Welcome to the Ronald Reagan UCLA Medical Center Labor and Delivery Tour. When you choose UCLA Health for your child's birth, you know you are being cared for at one of the nation's best hospitals. At UCLA Health, we are committed to providing you with a safe and empowering birthing experience. We will always treat you with dignity and respect, work with you to learn how we can best support you, give you clear information using an interpreter if you would like one, respect your values and personal boundaries, respect your culture, race, gender, sexual orientation, functional needs, preferences, nationality, language, and religion, and welcome and actively involve those you wish to include, such as family, friends, and a doula. And we have trained chaperones to help make sure sensitive exams and procedures are done in a safe, comfortable, and professional manner. And we want you to let us know if we do not meet these commitments. When you arrive at the hospital, you will enter through either our Westwood Plaza entrance or through the emergency department entrance. The Westwood Plaza entrance is a shorter distance to the east elevators, and wheelchairs are available if you are unable to walk. Our transport team will help you. Valet parking is offered at the Westwood Plaza entrance from 7 a.m. to 5 p.m. Monday through Friday, and the emergency department entrance from 7 a.m. to 5 p.m. 7 days a week. For parking prices, please call Patient Affairs at 310-267-9113. More details about our hospital location and parking are also available at uclahealth.org/Reagan/maps and directions. After entering the hospital, please go to the east elevators and take the elevators up to the 5th floor. Exit the elevator and make a left. Go through the Mattel Children's Hospital doorway shown here and make a right down the long hallway toward labor and delivery. There is a doorbell at the double doors to the entrance of labor and delivery, which you will push, and a UCLA team member will buzz you into the secure unit. We will be waiting for you at the greeter station located at the end of the labor and delivery hallway and will help you check in. Our labor and delivery suites are designed to meet all of your birthing needs. These large rooms include comfortable sleep couches, natural light, and everything we need to monitor you and your baby during labor and after delivery. You are welcome to bring a yoga ball if you would like, and we provide peanut balls if you will be laboring in bed. All of our labor rooms have private attached bathrooms with showers, which can be used as a comfort measure. We also offer a variety of pain management options, including nitrous oxide, and an anesthesiologist is assigned to labor and delivery full-time to help with your pain management needs. After your baby's birth, you will stay in the labor and delivery unit for your recovery before moving to your postpartum room. The cushion of the couch in the postpartum room pulls forward to create a wider sleep surface, and your room is furnished with the glider and footstool in addition to your adjustable bed. We practice rooming in, which means your baby will stay with you in your room throughout your postpartum stay. Rooming in allows you to bond with your baby and learn their behaviors that tell you when they are ready to feed. At UCLA Health, we offer a variety of services to make your birthing experience special. Some of these are aromatherapy, signature dining, bedside iPads and Wi-Fi, a UCLA onesie for your baby, nitrous oxide, 24-hour anesthesia support, souvenir birth certificates, lactation consultants, baby and me support groups both virtual and in person, and a spiritual care program. Our goal is to provide you with dignified and respectful care through a team approach. This means you will be cared for by a team that includes a doctor, resident doctors, nurses, lactation consultants who are experts in breastfeeding, care partners who are assistants to nurses, and others. Residents are doctors who are learning their OB/GYN specialty. They learn from attending doctors to build their future practice. Your birth wishes or plans are welcome, and we offer a template to create a birth plan on our BirthPlace website. If there are unforeseen circumstances, you will be involved in all discussions about your care to make sure that you and your baby are healthy during your stay. If you are considering having your baby circumcised, we encourage you to discuss this with your OB doctor. Circumcisions are considered elective procedures, and not all doctors perform them before discharge home. It is important to choose your baby's doctor before your baby arrives. You will schedule an appointment for your baby with this doctor 1 or 2 days after you go home, so this is important information to have when you come to the hospital. If you haven't already found your pediatrician, UCLA Health has pediatric practices throughout the greater LA area, including Burbank, Pasadena, Calabasas, the South Bay, West Los Angeles, and more. For a list of UCLA pediatricians near you, go to uclahealth.org or call 310-825-0867. The cost of having a baby varies depending on your insurance coverage. Please talk to your insurance company about your coverage. You can call your insurance provider and tell them the Ronald Reagan tax ID, which is 956006143, to find out if you are in network. UCLA Health financial counselors are also available to answer questions at 310-794-1125, option 5. If you have UCLA MyChart, pre-register for labor and delivery through the menu under Register for My Delivery. If you do not have access to MyChart, registration forms are available on the BirthPlace website under Planning for Your Child's Birth. Now let's talk about when you should go to the hospital and whom you should call. It's time to go to the hospital when your contractions are stronger and closer together. If this is your first baby, you should go to the hospital when your contractions feel strong, last 45 to 60 seconds each, and occur every 3 to 4 minutes for at least 2 hours. If you have had a baby before, go to the hospital when your contractions have been occurring every 5 minutes for at least 1 hour. If you feel water leaking or gushing from your vagina, you should come to the hospital for evaluation. But you do not need to wait for your water to break before you go to the hospital. It is normal to have bloody show, which is a small amount of blood and mucus discharge when your cervix starts to open. Bright red, heavy bleeding, which looks like a menstrual period, is not common. So if you have this, you should go to the hospital to have it checked. One of the best ways to keep track of a healthy baby is to notice their movement patterns. You can count movements every day, preferably at the same time every day. Start counting your baby's movements approximately 1 hour after a meal while you are lying down on your left side. If your baby does not move 10 times in 2 hours, you should come to labor and delivery or the fetal diagnostic unit for further evaluation. When you are coming to the hospital, call labor and delivery at 310-267-7560. If you have any questions during business hours, contact your doctor's office. After hours, call the UCLA page operator at 310-794-7274 and ask to page the on-call OB provider. We will provide you with all the care essentials you will need to care for yourself and your baby after delivery, but some items you will want to pack for your baby include a large blanket or shawl, a receiving blanket, a nightgown, shirt and sweater, cloth diapers and rubber or Velcro pants if desired, socks or booties, and an infant car seat installed in your car facing backwards. We recommend finding a car seat inspection station to ensure your infant's car seat is properly installed. Our nursing staff is not able to assist with putting your baby in their car seat. Car seat inspection locations can be found online at the National Highway Traffic Safety Administration website. Some items that the hospital doesn't provide, which you will want to pack for your stay, include a nightgown, robe, and slippers, personal toiletries and cosmetics, a change of clothes for your journey home, and other comfort items such as music, earphones, or your favorite pillow. We provide pads, baby care items, and breast pumps if needed. Immediately after your baby is born, as long as parent and baby are both stable, we assist you with skin to skin. During skin to skin, your baby rests naked against your bare chest. This close skin contact helps soothe your baby and regulates their heartbeat, breathing, and temperature. During safe skin to skin, baby's face is in a sniffing position, and you are able to gaze at their cheeks, face, and lips, making sure they have nice pink coloring. The parent practicing skin to skin should be at an incline and alert and ready to respond to the baby. The golden hour is the private time for you and your partner and newborn to come together for the first time as a family. We delay weights and measurements until after this special bonding time. It's during this golden hour when we assist you with practicing safe skin to skin for at least an hour. Oftentimes, this is the time your baby will complete their first breastfeed. Your labor and delivery nurse will place matching ID bracelets on you and your baby when your baby is born. Your baby will also have a security tag placed on their umbilical cord. All infant care areas at our facility are locked units, and all labor and delivery staff members must wear ID badges with a pink stripe. Other safety measures we have in place include taking photos of all newborns and only walking with babies laying in their bassinet when they are moved from one location to another in the hallways. Safe sleep practices begin in the hospital. Your baby will stay with you in your room and sleep in their own bassinet next to your bed. To promote safe sleep, we want to share the following recommendations for creating a safe environment at home for your baby. The ABCs of safe sleep are: alone. Babies are safest when they sleep alone. Back. Place baby on their back to sleep. Don't use pillows or blankets in the sleep area. You can place baby in a wearable blanket or sleeper and offer a pacifier at nap and bedtime once breastfeeding is well established. Clutter-free crib in the caregiver's room. Sharing a room with your baby on a separate sleep surface for at least the first 6 months is recommended. It's important to keep baby's sleep space free from pillows, blankets, and toys. Other recommendations for creating a safe sleep environment are to use a firm, flat mattress in a safety-approved crib, bassinet, or pack-and-play for every sleep. Feed breast milk for at least the first 2 months and ideally 6 to 12 months. Don't use head coverings after the first few hours of life. Avoid smoke and nicotine exposure during pregnancy and birth, as well as alcohol, marijuana, opioids, and illicit drugs. Maintain regular prenatal care and routine pediatric follow-ups and immunizations. And tummy time when baby is awake and supervised for short periods soon after discharge from the hospital. A neonatologist or newborn doctor and a nurse practitioner will supervise the care of your baby during your stay at the hospital. Screening tests that all newborns receive prior to discharge include the newborn screen, which is a blood test required by the state to check for metabolic conditions, a hearing screen, and a pulse oximetry screen, where a sensor is placed on the right hand and foot to measure blood oxygen levels. We offer different types of vaccines for baby and parent based on recommendations of the CDC and various professional organizations like the American Academy of Pediatrics and American College of Obstetricians and Gynecologists. Shown here are some of the vaccines we offer, but the vaccines offered to you and your baby will be based on your specific medical history. The flu vaccine is seasonal, meaning that it should be received once per year during flu season, and the pneumococcal vaccine is only needed for some higher-risk patients, such as those with a history of heart disease, lung disease, sickle cell disease, and diabetes, as well as other chronic illnesses. A birth clerk will visit every family on the postpartum unit. They will collect information for the birth certificate and a social security number and will explain the process for how to obtain a birth certificate. If you do not give your baby a name while you are in the hospital, we cannot submit for a social security card for your baby, and you will have to file for a social security number. Every baby born in California must be registered with a birth certificate. Preparing for your discharge home with baby begins long before the day you go home. Your care team will educate you about all the milestones for the birthing parent and baby that need to be met before discharging home. To help keep track of these milestones, we have My Journey Home boards in your room. Milestones for the birthing parent include eating and tolerating food, passing gas, the ability to walk and urinate, and well-managed pain. Milestones for baby include feeding well, having the appropriate number of wet and soiled diapers, having a healthy body temperature, and completing screenings and vaccinations. Discharge time is 11 a.m. We will escort you downstairs by wheelchair with baby in your arms, and the car seat can remain in your car. Thank you for taking the time to learn about what to expect when you come to deliver your baby at the UCLA BirthPlace. For more information and answers to our most frequently asked questions, please visit the BirthPlace website.